Hello, my name is Dr. Tadhg, Lynch. I'm a consultant pain specialist and I'm going to explain some procedures that can help you with your back pain. Back pain can come from three main structures in the spine. It can come from the discs, which are in between the bones. It can come from the sacroiliac joints, which are the large paired joints on the lower part of your spine, which are part of your pelvis. Or it can come from the facet joints, which are the knuckles in the back of the spine. Sometimes we can tell before doing a procedure where the pain is coming from. If people have pain when they bend forward and is central, it can be coming from the discs. If they have pain in the back, on one side or on both sides, and there's muscle spasm, it's often coming from the facet joints. This pain is worse when you lean backwards. If people have pain very low in the spine and have pain either sitting or crossing their legs, it can be coming from the sacroiliac joints. The way to find out is to do a nerve block to the joints or an injection of the joint, and that diagnoses where the pain is coming from. For facet denervation, we place the needle very accurately alongside the joint and we test it with x-rays and clinical testing to make sure that it's in the exact right place. Then we heat up the tip of the needle to 80 degrees for 90 seconds. That burns the nerve and stops the pain sensation coming from the joint. This needs to be done at a number of levels to denervate a joint, so there may be a number of injections involved, but it can give lasting relief. Evidence has shown that facet denervation, when it's been tested with a medial branch block, can give lasting relief for up to 12 months. For sacroiliac joint pain, we can also do sacroiliac joint denervation. For this, we place a needle alongside where the nerve supplies the sacroiliac joint and again heat the tip to 80 degrees for 90 seconds. And that takes the pain sensation away from the joint and can give good lasting relief that can last for up to a year. Radiating pain down the leg, also called sciatica, is caused when a nerve root is irritated. A nerve root can be irritated either by a crack in a disc, it can be irritated by inflammation around a disc bulge, or it can be caused by narrowing around the nerve where it comes out of the spine. So for that we do either a nerve root block for an individual nerve, or we do an epidural injection if the pain is more widespread. For a nerve root block, we place a needle very accurately where the nerve is coming out of the spine under x-ray guidance and inject a small dose of local anaesthetic and steroid. Because it's injected in a very small area, it can have a good effect. It has been shown in studies that local anaesthetic and steroid injections, nerve root blocks, can give as much relief as surgery if the disc bulges are small, less than 6 millimeters. If the pain is more widespread, we do an injection in the epidural space, either accessed between the lamina, called an interlaminar epidural, or through the caudal foramen, which is at the very base of the spine. When this happens, the local anaesthetic and steroid spreads up the centre of the spine and can give a good effect. Spine injections are safe. They're about 100 times safer than surgery. The risk of any severe complication is about 1 in 10,000, which is rare. A serious complication would be infection, bleeding, or nerve injury causing paralysis, but thankfully these are rare events. Steroids can have side effects that are either short-term or longer-term. Short-term side effects of steroids include flushing in the face and finding it difficult to sleep. Long-term side effects can include thinning of the bones. So the secret is to reduce the amount of steroid injections that you need. That comes from having the right diagnosis and the right treatment, so that you don't need to have frequent spine injections. For epidural injections, there is a risk of post-dural puncture headache, which happens when the needle going into the spine punctures the sac that contains the nerve and the fluid within the spine leaks out. This can cause a severe headache which can last for a couple of weeks. It usually settles down with conservative therapy, but sometimes an injection to seal the leak is required. With all spine injections, the pain can sometimes be worse before it gets better. With steroid injections, the pain can be worse for a number of days. The steroid usually kicks in a week. For denervation procedures, the pain can be worse for a couple of weeks, and usually the pain relief kicks in by then.